when I treat patients, there are two goals for me. The first is to make patients live as long as possible, which is the quantity of life. And the second and important thing also is the quality of life. If I am treating a cancer, such as, like I said, there are many different types of cancer. You have testicular cancer, you have ovarian cancer, you have breast cancer, lymphomas, leukemia. So I treat testicular cancer, lymphomas as well. And they are extremely sensitive to chemotherapy. It's like some of the weeds in your backyard. You spray a bit of weedicide, it goes off, and that's the end of it. On the other hand, some weeds you spray, they stay quiet for a few weeks and then they start to grow. So breast cancer is not insensitive to chemotherapy, but it's not super sensitive to chemotherapy. It falls in the middle. So with chemotherapy, in early stage, we can cure a proportion of patients, not all patients, and in advanced stage or secondary breast cancer, we can control the disease, shrink it, but not get rid of it. So that's important. So when I can't get rid of a disease, and my aim is to make patients live as long as possible, it's also equally important that patients have a good quality of life. Whatever number of months or years my patients are going to live, we have to balance their needs, their treatments, and their quality and their lifestyle all together. So that's a very important point, and I do pay a lot of emphasis to that. But obviously, a lot of things about quality of life is dictated by what someone's cancer is doing. Obviously, if someone's cancer keeps on getting worse, every time with every new treatment, their quality of life will be dictated by their cancer, not necessarily by their treatment. Now, over time, the cancer grows like that. So what you do is you do chemotherapy, it shrinks, and then you may have a pause for a few months, and then it starts to grow. And then you do chemotherapy and it shrinks. But what it tends to do is this is what it does over time. So in general, the response is highest after first lot of chemotherapy. And as you have subsequent lines of chemotherapy for advanced breast cancer, the chances of response or shrinkage goes down. And the period for which you might be able to have a break from chemo also lessens over time, because the cancer becomes more resistant. So that's the other thing. So obviously we have a number of treatments, and the first one, if you have estrogen receptor positive tumor, we use the estrogen blockers. And then the second is obviously the chemotherapy, and there are many different types of chemotherapy. And patients who have HER2 positive breast cancer, we use HER2 targeting agents. And obviously clinical trials are very important.